Welcome back. Thank you for staying with us. The Ministry of Health and Wellness today, Tuesday, the 6th of July, received confirmation of 26 new cases of COVID-19 from a total of 310 samples taken during the period the 29th of June to the 5th of July. The contact tracing for these new cases is underway. Confirmation was also received of the recovery of 13 individuals, bringing the total number of active cases to 96. At present, 3 of the active cases are requiring critical care at the respiratory hospital. The new cases bring the total number of cases diagnosed in country to date to 5,352. Following a confusing release about 5 COVID-19 related deaths on the 22nd of June, the Ministry of Health promised further information in a subsequent statement, given that some of the deaths were backdated from February. During a press conference on Tuesday, the Ministry of Health and Wellness announced that it has concluded its exercise of reclassifying the country's COVID-19 related deaths. The national epidemiologist spoke on why the reclassification was important and its findings.
From the onset of the COVID-19 pandemic, the Ministry of Health and Wellness's reporting on its COVID-19 mortalities included every patient who tested positive for COVID-19 at the time of their death. But with commitments to local, regional and international bodies, the classification of COVID-19 deaths had to be revised. According to the national epidemiologist Michel François, the exercise was undertaken to ensure that when the information is requested by other parties, it is readily available.
So when we talk about death due to COVID, we are speaking of an individual who presents with the clinical illness, which is compatible with COVID-19, and unless there is a clear alternative cause, which is not related to COVID-19. So in the case of trauma, an individual who happens to, for whatever reason, a homicide, and at the time of his death is diagnosed with COVID or test positive for COVID-19, this individual would not be classified as a death due to COVID. His death would have been the result of the trauma, whatever homicide, be it gunshot injury or stab wound, whatever. Also, there should be no period of recovery from COVID-19 between the illness and death. So if an individual tests positive for COVID-19 and 2 months down the line he dies, he or she passes away, that individual did not pass away because he made a full recovery, so he did not pass away due to COVID-19.
She assured the public that no alterations were made to the death certificates of individuals.
At the Ministry of Health and Wellness, we do not sign death certificates. What we do is review the death certificates. So based on the chronology of events which the attending physician had documented on the death certificates, we use this to determine whether it was a COVID death or a COVID-related death. And so, for example, an individual in the cause of death on a death certificate, an individual who tests positive for COVID-19 may develop a pneumonia, and that pneumonia may lead to acute respiratory distress syndrome, and that would be classified as a COVID-19 death. Similarly, as I explained, an individual who, for example, has a heart attack, that would weaken the heart and cause some sort of heart failure, and so this individual testing positive for COVID-19, and if you notice, COVID-19 is written in part 2, and there are 2 parts to this death certificate. So that individual would not be classified as a COVID-19 death because his underlying illness was the heart attack, and which led to heart failure and the resulting death.
Following the reclassification exercise, there are now 60 COVID-19 deaths and 25 COVID-19 related deaths. For the Hot 7 News, Nisha Charles reporting.
As St. Lucia continues the phased reopening of the country, the Ministry of Health and Wellness is stressing on the updated list of protocols. Of particular importance is the exemption of quarantine for fully vaccinated travelers. The Chief Medical Officer is reminding the public of what that means and the guidelines that go along with entering St. Lucia.
Even if you have your negative test and you're fully vaccinated, that you have to still apply for authorization more than 7 days in advance of travel. And that gives us a chance because you need to upload your negative test. You also need to upload your vaccination card. And for those who are requesting home quarantine online, it gives us a chance to do the examination of the home for approval. So it's really important that you still apply. We've been getting a lot of complaints of persons who just buy a ticket and go to the airport. You need the authorization. We are trying as much as possible to keep travel safe in terms of persons having a negative test and being fully vaccinated, so that it'll be very easy when you come in.
Dr. Belmar George also explains the removal of the Caribbean bubble.
So we looked at the level of disease within the other islands, and for those who kept a certain level, we would allow them to come in without quarantine. The level of risk in the region has changed. We also note the presence of all 4 variants of concerns within some of the countries of the Caribbean bubble. So a decision was taken that the Caribbean bubble, the countries within the Caribbean bubble, would fit into the same protocol for the rest of the world, where fully vaccinated persons come in without quarantine, and everybody else who's not vaccinated would have to go through the quarantine process.
St. Lucia remains at high risk of introduction of variants of concern.
We note that 54% of the CAFA member states are still reporting community spread, and all 4 of the variants of concern are present in the region. And we know that they spread faster, they cause more severe and a higher death rate as usual. We know that the WHO as well, they've updated their naming convention for the variants of concern using the Greek alphabet. So the alpha is the one which we call the UK variant, and this is the one which we've noted in St. Lucia. I also want to indicate that we continue sending samples to the Caribbean Public Health Agency for sequencing, and to date, all of the results that we've got indicate the presence of the Alpha variant, which is the UK or the British variant.
That was Chief Medical Officer Dr. Sharon Belmar George. Negotiations continue between the CSA and the Ministry of Health regarding the transition of workers to the Millennium Heights Medical Complex. The Secretary General of the CSA says the association is awaiting documentation to prove that the concerns of workers have been addressed.
There has been much unease within the public sector when it comes to the transition from the OKEU Hospital, the Victoria Hospital, Turning Point, and the Wellness Center to the Millennium Heights Medical Complex. A myriad of concerns were raised, ranging from work benefits to salary reductions. On April 28th, the St. Lucia Civil Service Association, CSA, wrote a letter to the Permanent Secretary of the Department of Health and Wellness, relaying concerns of its members. Previously, the CSA took the stance that no contracts would be signed unless the relevant authorities addressed the various concerns highlighted. Almost 2 months later, the General Secretary of the CSA, Claude Paul, says there seems to be some headway being made with regards to the concerns of the CSA's membership.
We were able to convene a meeting with the Permanent Secretary in the Ministry of Health, and also in attendance were some of the officials from the Millennium Heights Medical Complex. It was an encouraging meeting, and there are certain documentation that has to be provided to us, including cabinet approval of supernumerary post, as well as an addendum or draft addendum to our collective agreement to give the CSA the right to continue to represent the workers, what we call succession rights. And, well, we are still awaiting those documentation, but I suppose the passage of Tropical Storm Elsa would have affected a number of things, and so we wait. Basically, we want our members to be assured that CSA is still very much concerned about the situation.
Paul says the union will remain focused on this situation as they aim to ensure that the rights of members are protected. He says the CSA will not move forward until it receives confirmation in writing on the promises that were made in various meetings.
We have to receive those documentation, and then we will take it from there. We are hopeful, based on the tone of the meeting, that things are heading in a positive direction, but as in other cases, we have to see the proof before we can be elated. I mean, we know in the past we had the situation with Radio St. Lucia where the government promised to hire the displaced workers into the public service. That never happened. And so the CSA is very skeptical about promises being made. And until we see proof of it, we will not jump for joy. But as I said, it was a positive meeting, and I think we are heading in the right direction.
While a 2-week notice was issued by the CSA to receive the requisite documentation, Paul says it is understandable that things may slow down. He says, however, the union is expecting to receive all documentation within a reasonable period of time. Reporting for Hot 7 News, I am Genevieve Gonzalez.
Stay with us, there's more news after the break.